Hey, hi. Hello, my friends. Welcome. Hey, hi. If you know what that's from, drop it in the comments. Thank you for joining me this evening. If you are here live, you know the drill. If you're here live, drop a hashtag live in the comments. If you're here watching the replay, then drop a hashtag replay for me in the comments. This is the second day of a series of 3 about thyroid health that I'm doing. If you missed yesterday's live, we talked about what the thyroid is, what it does, and signs of dysfunction. So you can go back and watch that one later on after this one in my Embrace Your Worth Wellness Facebook page if you'd like to do that. And if you'd like to invite anybody, you can go ahead and do that right now. I think there's a share button like right underneath this video that you can share with anybody. And I'm going to double check here and make sure it's showing up. Looks like it. Okay, good. Okay, so we are talking today about thyroid testing and what tests we should request from our doctors if we're experiencing symptoms of thyroid dysfunction, and why we should request them. Why we should request these tests that I'm talking about instead of just assuming that the doctor will do a thorough thyroid check. Okay. Tomorrow, we're going to talk about testing ranges and why they matter. So that's going to go really nicely with what we're talking about tonight, because normal ranges do not always necessarily mean optimal ranges to where you're feeling good. So you don't want to miss that one either. So be sure to invite any friends that would benefit from this information so they can learn something about their thyroid, especially if you or somebody that you know has been on thyroid medication for a really long time and they were just told, yeah, you're just always going to have to be on thyroid medication. That's what my doctor told me. That's what my mom's doctor told her. That's what my grandmother's doctor told her. And that's all we were told, nothing else, like no further education. And, we didn't really ask questions because we didn't really, I guess we didn't know we could or should. I don't know. So, anyway, if that sounds familiar to you, that scenario I just talked about, drop the word familiar in the comments for me. I have learned that this scenario is very common. So I'm just wondering what it's been like for you. All right, let me check and make sure we're doing okay over here. Yes, we are. Okay. So let's jump right in and get started because I do want to honor your time. I do appreciate your being here. I do want to start though with my quick disclaimer though, that I am not a medical professional. I am not trying to diagnose anybody or give you any medical advice. What I am trying to do though, is to educate you, empower you with some information that you can use to help you move forward on your own health journey and to help you be your own health advocate. So this is information that I have learned from doing my own research, from my health coach that I see, from my functional medicine doctor, and from other functional medicine doctors and practitioners that I follow online and that I've read their articles and I read their books and things like that. So there you go. There's the disclaimer. And who the heck am I? Well, if you already know me, drop something in the comments about tell something silly or goofy about me. I'm going to make myself vulnerable a little bit. So go ahead and do that. Drop something silly or goofy about me if you know me already. And in case you don't know me, my name is Mandy Sawyer, and I taught middle school English and reading for about 15 years. I left teaching, though, when my health was spiraling out of control. It had been going on for a lot of years, and seeking help from my doctors for a really long time, but I didn't get much help from them. And then a year later, after I left teaching, I was diagnosed with Hashimoto's disease, which is where your immune system attacks the thyroid, which is why I'm really big on, the whole thyroid topic right now. So that scenario, that finding out that I had an autoimmune disease really flipped a switch for me. And I thought, oh my God, holy crap. If I feel this way at age 51, what am I going to feel like when I'm 80? Am I even going to make it to 80? I don't know. So I knew it wasn't going to get any better, especially with this diagnosis, if I didn't make some major lifestyle changes. And so I did make a bunch of changes, have made a bunch of changes, still making a bunch of changes. And fast forward to present day, I am now helping other women prioritize their wellness and teaching them to be their own health advocates and helping them to be successful on their own health journeys. So that's me in a nutshell. At any point in time, just going to check to see if, hey, Lindy, how are you? Yay. I love animals. Yes, I do. You're right. Love you. Okay, good. At any point in time you want to ask a question, please feel free to do so in the comments. And I will do my best to answer it either during the live or after the live is over. I hope you're not hearing all the squeakiness of my chair. I'm sorry about that if you are. Okay, here we go. Next slide. All right, so I want to start talking about thyroid testing by giving you some information about the approach that functional medicine takes versus the conventional or traditional medicine approach to thyroid testing and to anything really. So functional medicine focuses on getting to the root cause of the problem, the root cause of the symptoms. They take a holistic approach instead of just treating symptoms only. Functional medicine looks at all aspects of the patient, including lifestyle, diet, past infections, traumas, stressors. And functional medicine doctors and practitioners, they generally spend more time with their patients, at least on the initial visit, like 60 to 90 minutes. I believe mine was 90 minutes. So they can be more thorough about getting your history and learning about what's going on with you. Now, it can be more costly to go to a functional medicine doctor or practitioner when insurance won't cover everything that the practitioner is suggesting, because there's some tests that a functional medicine doctor will order for you that a conventional medicine doctor will not. So a lot of times insurance won't pay for those. But any traditional labs, like these thyroid labs that we're going to talk about tonight, you can get your insurance to cover those. For me personally, just so you know, I've gotten more information and have felt more heard in the past year that I've been seeing a functional medicine doctor than I did in all the years before when I was seeing a conventional doctor. So I'm not saying that conventional doctors are bad. Please do not think that I'm saying that, because I'm not. But I am telling you from experience that I feel like I've made more progress with my health since going to a functional medicine doctor than I did with the other doctors. And I'm not going to lie, it is more costly. It is costly. And I don't have insurance right now, but I look at it like I can either pay now or I can pay later. I can pay later with my health and a lot more money. Okay. Because the disease will have progressed a lot more if I stick with conventional medicine. So, sometimes I do have to pace it though and put off buying a particular supplement or something like that until later, but it is doable. It is doable to go to a functional medicine practitioner. But let's talk about traditional medicine now, conventional medicine. Conventional medicine tends to treat the symptoms, and I feel like they're really bound by insurance companies, but we do have cutting edge technology to diagnose and treat diseases and illnesses, which I'm very grateful for. We are great at emergencies and surgeries. I mean, like if I cut my finger off while I'm chopping up some carrots, then I definitely want to be able to go to the emergency room and have somebody potentially sew it back on. Hold on a second. I need to check this. Okay. So in emergency surgeries, my mom, thank God, her life was saved by an emergency surgery. So was my grandfather. Different surgeries, obviously, but however, the general care overall is somewhat dictated, like I said earlier, by insurance companies with traditional medicine, instead of being dictated by patient-doctor relationship, deciding on what form of treatment they should do next. Conventional medicine doesn't usually do well with preventative measures like diet, lifestyle changes, things like that. I mean, they might suggest it. Oh, you need to lose weight, or here, try this diet or whatever. But you don't get much education or support with that. And, 15-minute visits do not allow for a thorough investigation of your health. Can I get an amen with that? So, okay, let's go back to the thyroid testing part now. Does this mean that you have to go to a functional medicine doctor to get the thorough thyroid tests? No, you do not. I didn't know about anything about functional medicine until when I learned about my Hashimoto's, because I was going to another doctor at the time. So I'm going to skip that part. I was That's not necessary to tell you that. Okay. Yeah. I was going to another doctor and she had even done, I'd gone to her for like a year. She'd even done a sleep apnea test on me to try to figure out why I was so fatigued. But when I found out about what test that I'm going to talk to you about tonight, what test to ask for, I found this out from a lady from Oklahoma City in a Oklahoma City Facebook, ladies Facebook uh, group. Hey, Reba. Yay. I'm glad you made it. So anyway, the point is, I had, I found out just by a normal person, not by a doctor. So I went in and I asked the doctor, can you do these tests for me? She said, sure. So the point is, you don't have to go to a functional medicine doctor to get a thorough thyroid test. You can ask for them from your regular doctor. In fact, I actually asked my mom's doctor a few weeks ago to run a full thyroid panel on her because I knew she had been on thyroid meds forever. And I know that there's a genetic component to Hashimoto's and other autoimmune diseases. So I butted in kind of and I asked her first, but asked mom to let me ask the doctor for those tests. And he was fine with running the tests. And lo and behold, she has the antibodies consistent with Hashi, and Lord only knows how long she's had them. So, okay, let's move along. Why did I have to request these certain tests? Well, because when conventional doctors check your thyroid, the standard practice seems to be to only check TSH, which is thyroid stimulating hormone. So it is likely that if you go in and say to your doctor, hey, I want you to check my thyroid function, they'll say sure, and they're likely to check TSH and nothing else. But if you're like me, sometimes that TSH level will come back in the normal range, and they'll tell you that it's normal. They'll tell you you're fine, but you're not fine. You don't feel fine. So then they might say, well, you're just getting older. Here's your script for more thyroid meds. See you in 3 to 6 months or whatever. And you come away with no real answers, still feeling like crap and frustrated to no end, and maybe even thinking you're crazy because you don't feel good. And you've been to the doctor, they've done the tests, and supposedly you're normal. So if that's happened to you ever, I'm really curious as to what your doctor said to you. Has your doctor ever said anything like that to you? Like, oh, you're normal, but you don't feel good. Your labs are fine, or, you're just getting older, or, or maybe you're just depressed. You're some antidepressants or whatever. I'm just curious if you've ever had that situation happen. Okay, so yesterday we talked about these signs of hypo and hyperthyroidism, and I'm just going to run through a few of them here. I've got them listed for you up on the screen, but I'm just going to say a few of them out loud: fatigue, anxiety, depression, infertility, muscle pain, joint pain, carpal tunnel syndrome, constipation, brain fog, dry or cracking skin, brittle nails, hair loss, loose stools, osteoporosis, hand tremors, elevated heart rate. That's just some of the possible hypo or hyperthyroid signs or symptoms you might be having. So if you're experiencing any of these symptoms and you haven't had your thyroid checked in the past 6 months or so, I encourage you to do so. And find your previous labs and look to see if the thyroid section lists more than just TSH. I'm really curious about that. Okay. So what thyroid test should you request? That's the big question, right? Here is what was suggested to me and what I've also read and researched. This has also been suggested. There are a couple other things you could check besides these, but you just kind of talk to your doctor about it. Like there's something called reverse T3, and then possibly getting an ultrasound, a thyroid ultrasound, if you suspect any nodules or a goiter or something like that. But these are the ones that will get you started on knowing more of what's going on with your thyroid. You'll want to ask for a full thyroid panel, but please, I'm telling you, be specific and ask for these that are listed. It's okay to be very clear and to ask for what you want from your doctor. Sometimes I think that we shy away from being assertive, and you can be assertive without being rude, being assertive with kindness or whatever, because we don't want the doctor to think that we don't trust them or that we think that we know more than they do because they've had all the training. But the thing is, it is your body. It is your well-being, and you have a right to take a collaborative approach with your doctor concerning treatment and care. Any questions so far? Let me read the list. Here's what you want to ask for: free T3, free T4, TSH. They will most likely check that anyway, and thyroid antibodies. They're called thyroglobulin, sorry, and peroxidase. Even if your symptoms are not debilitating and don't hinder your day-to-day activities, get a handle on it early. Don't wait until it's worse, because it will take that much longer to heal your body. Ask me how I know. Okay. I'd love to answer any questions that you might have at the moment. Tell me if you've learned anything new so far, or if there's something that you already knew but it was clarified for you tonight. I do want to be mindful of the time. Okay, good. We're doing really good on time. Any questions? Have you learned anything new? Or did I go over something that you knew already, but maybe you got a little clearer picture of it? I'm going to take a quick drink. Okay. No questions so far. All right. So free T3, free T4, TSH, thyroglobulin, and peroxidase antibodies. That's what you want to ask for. So in the next live tomorrow, Wednesday, March 1st, we are going to talk about thyroid test reference ranges, okay, and why they matter. You're not going to want to miss this. Even if you can't show up live, at least watch it on the replay. Because the ranges, like I mentioned earlier, just because it's in the normal range, and this is why doctors kind of get it wrong sometimes. It's like, just because it's in the normal range doesn't mean that you feel good, doesn't mean that it's optimal. Okay. So we're going to talk about those optimal ranges, what functional medicine says are those optimal ranges. We'll talk about that tomorrow, so that you can kind of have some information to where you can compare your labs to those optimal ranges that they talk about. Okay. So let's see. Join me live tomorrow at 7 p.m. Follow me on Facebook and Insta on at Embrace Your Worth Wellness. Insta is very bare. I just put it up the other day, so I don't have much on there. Excuse me. And of course, there's my website, embraceyourworthwellness.com, where you will find more information about my private one-to-one health mentoring packages. And if you are ready to march into March confident about your wellness goals, if you're looking for more support for your thyroid health, if you are looking more support for autoimmunity or being your own health advocate, or just health goals in general, maybe you need just that accountability piece. You need somebody to help you research, maybe because you don't have time to do all the researching. Maybe you're a busy mom or a busy teacher or whatever, but you need the information. Then I would love, love, love to assist you if you're interested. I do meet my clients wherever they are on their health journey. Like, I don't care if you decide, oh, I want my goals to be going to the gym 5 times a week, or I want my goals to just like, let me add some water to the regimen, right? Let me like try to drink some more water. I don't care where you are on the scale or on your journey. I'm here to help you. So you can check out more information about those packages at embraceyourworthwellness.com, or just message me here. And I'm going to drop my scheduling link in the comments so that you can, or in the post probably, so you can schedule a short consult with me. It's a free consult with me, to where I can explain more of how I can help you and how I help my clients, or you can ask me questions about it, whatever you want to do. Okay. And I really do appreciate your showing up and watching. And I hope you learned something new and are ready to embrace your worth and be your own health advocate. Let me check my comments really quick. Okay, good. Good, Lindy. Knowing the specific test is super helpful. Great. I'm glad. Dr. Rand T4 and said nothing is wrong. All looks good. I go in March and we'll ask him for more. Okay. Yeah, ask him for more. The T4, here's the thing. T4 converts to T3. So like T4 is the inactive part of it, sort of. This is the best way to explain it. T4 is like the inactive part. T3 is the active part. So your T4 might look really good, but if it's not converting the way it's supposed to T3, you might have low T3. I don't know. Like that'd be something I would definitely ask about, and I would definitely, want to know more about, because the usually I'm going to guess that you're possibly on like levothyroxine or something like that. Levo is usually the go-to medicine for thyroid. and it's a synthetic T4. But they're banking on the fact that your body is converting the T4 to T3 like it's supposed to. But my doctor looked after dealing with me for a while. She's like, doesn't look like you're converting. We're going to have to give you some T3 as well. So anyway, so that's, definitely something to consider. Definitely ask the doctor about that. Cause if you're still having symptoms, like we talked about, like hypo and hyper, these symptoms, then something is not adjusted right. And we're going to talk about the range stuff to look at tomorrow as well. But definitely ask about that, because like I said, T4 is supposed to convert to T3, but sometimes people are not converting it, and it converts in different places in your body. So it's supposed to convert in your liver, it's supposed to convert in your thyroid, it's supposed to convert in your gut. And there's some other ones I can't remember exactly. So there's different places in your body that it's supposed to convert. Well, if you've got issues going on somewhere else, then maybe it's not converting those. So if you've got like some gut issues or whatever, it may not be converting well in the gut because the gut's all jacked up or whatever. So there are different things you might want to look at for sure. So, okay. Anything else? Any other questions? Thank you guys so much for responding and participating. I love it. Okay. Let's see. Did I say anything? Okay. I said all that. Great. Okay, guys, if there's nothing else, I really appreciate you, and I hope you have a great rest of your evening. Be good to yourself, and I will see you tomorrow.